Imagine a world where these invisible threats, like bacteria and viruses, are constantly lurking, especially in places meant to heal us, like hospitals. How do we actually stay safe from these unseen enemies, particularly in those really busy healthcare settings?
It's a huge question.
It is. And today we're doing a deep dive into the fascinating world of the people who guard against those threats, the infection control specialist. Often unseen heroes, really.
Absolutely. And we've got some fantastic insights today drawn from a really detailed interview with an infection control specialist.
Oh, great.
Yeah, so this isn't just textbook theory,
Uh-huh.
It's practical, hard-won experience, how infections are actually prevented and managed out there in the real world.
That's exactly what we want. So our mission for you in this deep dive is to kind of distill the key nuggets of knowledge from this material.
Give you that shortcut.
Exactly, a shortcut to understanding this crucial role that, honestly, touches everyone's health. We'll uncover how these specialists protect us, how they prevent outbreaks, ensure our safety, often completely behind the scenes.
Working away diligently.
Right. So let's start there. What exactly is the core identity, the main job of an infection control specialist, day to day?
Oh, at its heart, their main role is pretty clear. Prevent and control infections, mostly in healthcare settings, but also other institutions.
Okay, prevent and control. Sounds simple, but I bet it's not.
Oh, definitely not simple. It involves a whole host of responsibilities, things like developing protocols, meticulously training staff.
Training must be key.
Huge. And constantly monitoring infection trends, looking for patterns, and of course ensuring everyone complies with all the regulatory standards. It's a lot.
And the why behind all that.
The ultimate goal. It's straightforward, but vital. Protect patients, staff, and visitors from harm. Every single thing they do ties back to that safety aspect.
Wow. Okay, that sounds like a monumental task. I mean, tackling something invisible, pervasive. How do they even begin? What does a risk assessment actually look like in infection control?
Yeah, it's a challenge. It is a systematic approach, definitely. But I think the real insight often comes from spotting the risks that aren't immediately obvious.
Like what?
Well, you assess potential sources of infection, sure, but then you look hard at the vulnerability of different patient groups. Think about someone immunocompromised versus someone generally healthy, totally different risk levels.
Right.
And then you scrutinize current practices. Are they actually adequate? Sometimes a tiny change in workflow or even how a piece of equipment is designed can create a surprising new weak spot.
So you find the vulnerabilities, then what?
Then you prioritize. Based on how severe the potential harm is and how likely it is to happen, only after that careful prioritizing do you implement specific strategies to mitigate those risks.
Okay, prioritizing makes sense. So once they've assessed these risks, how do they track these invisible enemies? Is it all just crunching numbers?
It involves data, absolutely, but it's more about making that data tell a story, We use these pretty sophisticated surveillance systems. Think of them like global early warning networks for infections.
Early warning networks, I like that.
Yeah. For instance, there's NHSN, that's the National Healthcare Safety Network here in the U.S. It's this massive CDC database where hospitals pool their infection data.
So they can compare.
Exactly. Benchmark themselves, see how they're doing compared to others. And then there's HO, developed by the WHO. That's global software for managing microbiology data. It helps track things like antibiotic resistance trends internationally.
Wow, so it connects globally.
It does, and these systems are just essential for catching things early, for responding quickly if an outbreak looks like it might be starting. It's all about being proactive, not just reacting after the fact.
That makes total sense.
Yep.
Okay, so you've identified threats, you're tracking them. What are the frontline measures? What do they recommend to actually prevent those healthcare-associated infections, the HAIs that we hear about?
Right, HAIs are a huge focus. It's really a multi-layered defense system. You rely on a whole combination of vital measures working together.
Like what specifically?
Okay, so you've got standard precautions, the basics. Then meticulous hand hygiene, which sounds simple but is critical. Thorough environmental cleaning, sterile techniques during procedures. Then there's antimicrobial stewardship that's about using antibiotics wisely. And of course, staff vaccinations. All these layers work together.
You mentioned environmental cleaning. Tell me more about that. How critical is it really?
Oh, it's profoundly critical, often underestimated. Specialists make sure cleaning protocols are followed precisely, like using the right disinfectant for the right bug.
Ah, okay. Not just any cleaner.
Exactly. And making sure high-touch areas, bed rails, doorknobs, keyboards are cleaned frequently. It also involves regularly auditing the cleaning process and training the housekeeping staff. They are truly on the front lines, doing tough, often overlooked work to keep that environment safe.
That attention to detail is amazing. It brings up something I've noticed as a visitor. Sometimes you see different signs on doors or staff wearing different gear. What are those different levels of protection and why the variation?
Ah, yes. Good question. You're likely seeing different types of precautions, each tailored to how specific infections spread.
Okay.
So, first, there are standard precautions. Think of these as the universal foundation, applied to all patients. Basic stuff like thorough hand hygiene and using PPE, personal protective equipment, if you anticipate exposure to bodily fluids.
Right, the baseline.
Exactly. Then you might see contact precautions. These are for infections spread mainly by touch, like C. diff or MRSA sometimes. That requires staff to wear gowns and gloves when entering the room.
Gowns and gloves, got it.
Then for respiratory infections spread by larger droplets like flu or pertussis, we use droplet precautions. This typically means staff wear a surgical mask when close to the patient.
Surgical mask, okay.
And finally, the highest level for diseases spread through tiny airborne particles that can hang in the air, like tuberculosis or measles or even COVID-19 in certain situations, is airborne precautions.
So it sounds serious.
It is. That requires specialized N95 respirator masks, which filter out those tiny particles and often placing the patient in a special isolation room with negative pressure ventilation to prevent air from escaping. Each level is precisely matched to the specific transmission risk.
Wow, that's quite a system. But what happens when prevention isn't enough? Despite all those precautions, what if a suspected outbreak does occur? What are the immediate steps?
Yeah, that's the scenario you hope to avoid but have to be ready for. The moment an outbreak is suspected, it triggers an immediate, rigorous investigation.
What does that involve?
First, you rapidly isolate any suspected cases. Stop the spread right there. Then collect samples, swabs, blood tests, whatever's needed for precise lab testing to confirm what you're dealing with.
Okay.
And crucially, you notify the relevant public health authorities. Outbreaks rarely stay neatly confined to one place.
Right, because of public health issue.
Exactly. Simultaneously, you implement specific, targeted control measures based on what you're learning about the infection. And maybe most importantly, you communicate constantly with staff, with patients. Clear, honest communication is vital to prevent panic and make sure everyone knows their role in containing it. It really is a race against the clock.
Sounds incredibly stressful.
Yeah.
And adding to that stress, what about those really tough infections? The multi-drug resistant organisms, the superbugs. How does infection control deal with them?
Ah, MDROs. Yeah, managing those, that's probably one of our biggest ongoing battles. Because these superbugs, they're essentially evolving faster than we can develop new drugs to fight them.
Which makes common infections potentially deadly.
Precisely. So dealing with them means, yes, implementing heightened contact precautions, definitely ramping up environmental cleaning because these bugs can linger on surfaces for a long time.
Makes sense.
But the real game changer, honestly, and maybe our most powerful weapon against MDROs, is strict antibiotic stewardship.
Antibiotic stewardship. What does that entail exactly?
It means working really closely with pharmacists and the doctors, the clinicians. We meticulously monitor how antibiotics are being used. We educate staff constantly about the urgent threat of resistance. It's growing fast. And we develop really clear protocols to minimize any misuse of these precious medications. It boils down to ensuring the right drug at the right dose for the right duration, and critically, only when it's truly necessary.
So not just prescribing them automatically.
Exactly. It's a continuous, often uphill battle to preserve the effectiveness of the antibiotics we still have left. And this impacts everyone, not just people currently in the hospital. It's a societal issue.
It really sounds like it. And it also sounds like an ongoing challenge, getting everyone to follow these protocols consistently. How do you ensure staff actually follow all these critical policies, especially under pressure in busy units?
You've hit on a really critical point there. Staff compliance is absolutely paramount. It's not easy, but we ensure it through a combination of things. Regular training, yes. Routine audits to check practices on the floor.
Like spot checks.
Kind of, yeah. And providing constructive feedback, not punitive, but helpful. We also use clear signage, lots of reminders, and performance monitoring.
And what happens if someone isn't compliant?
Well, it's addressed constructively, usually privately first. We clarify the risks involved. Sometimes people just don't fully grasp the potential consequences. We provide additional training if needed, and we collaborate with leadership to ensure policies are enforced, but always trying to maintain a supportive environment. It's rarely about pointing fingers. It's about understanding the barriers and helping people do the right thing.
That sounds like a good approach. What about new staff? How do you get them up to speed?
Training new healthcare workers is incredibly comprehensive. They really are that first line of defense. Their orientation covers all the basics: standard precautions, how to use PPE correctly, which is often more complex than people think.
I can imagine.
Definitely. Essential hand hygiene techniques, safe ways to dispose of waste, and clear protocols for what to do if an outbreak happens. And it's not just lectures, it's supplemented with hands-on demonstrations, practical assessments to make sure they've really got the skills down. We've seen situations where that meticulous initial training truly prevented a wider spread later on.
So it's not just the healthcare workers, right?
hmm
Patients and visitors are in the hospital too. How do you bring them into the loop on infection control without overwhelming them?
Absolutely. They're a crucial part of the picture. Educating patients and visitors is key because, well, they're part of the healthcare environment. We use different tools for that.
Like what kind of tools?
Things like easy-to-understand brochures, clear posters in waiting areas or rooms, sometimes brief in-person chats to teach essential practices.
All kind of practices.
Really fundamental stuff. Effective hand hygiene, respiratory etiquette, covering coughs and sneezes properly and explaining the visiting guidelines, especially if there are restrictions. The key is translating it all into simple layman's terms. The goal is clarity, empowering them to help protect themselves and others, not burying them in medical jargon.
Empowering them, I like that. It sounds like this really isn't a solo job for the infection control department. How do you work with all the other departments? Housekeeping, surgery, the labs?
Oh, that's maybe one of the most fundamental aspects. Successful infection control is all about collaboration. It absolutely cannot be done in a silo.
So how do you foster that collaboration?
We work hard to foster open, continuous communication. We consistently share relevant data and any concerns we have. We actively involve various teams in decision-making processes that affect them.
So they have buy-in.
Exactly. Whether it's talking to the facilities team about ventilation systems, or supply chain about getting the right PPE, or environmental services about tweaking cleaning protocols, it's vital to constantly emphasize that infection control isn't just our department's job. It's a shared responsibility, a collective effort across every single part of the institution. We really are all in it together.
We've talked a lot about controlling threats within a room, but patients move around, right?
Yeah.
They go for tests, maybe move floors. Even that seemingly simple transport must have infection control angles.
It absolutely does. You're right. Patient transport isn't simple from an infection control perspective. It requires specific precautions.
Such as?
Well, if a patient has a respiratory issue, they should be masked appropriately during transport. Everyone involved, the transporter, the patient if possible, needs to practice good hand hygiene. And critically, any surfaces in the transport vehicle, like the wheelchair or stretcher, must be thoroughly disinfected after each use.
Makes sense.
And another key piece is communication. Clear communication between the department sending the patient and the one receiving them ensures the receiving end is fully prepared, knows what precautions are needed, and avoids any surprise transmissions. It's all about thinking several steps ahead.
Thinking ahead seems to be a theme. Now, beyond all these internal processes, do you face scrutiny from the outside? Audits, inspections from health authorities, what's that like?
Oh, yes. Regularly. We actually lead a lot of internal audits ourselves, constantly checking our own practices. But yes, we are also responsible for preparing all the paperwork and being ready for inspections by external health authorities, like the state health department or accrediting bodies.
That sounds stressful.
It can be quite rigorous, and when they provide feedback, whether it's good news or identifying areas needing improvement, we're then tasked with developing and implementing corrective action plans very quickly. So it's this continuous loop. Assess internally, get audited externally, respond, improve, repeat.
A continuous cycle. And thinking about large-scale challenges, did the specialists you interviewed handle infection control during the COVID-19 pandemic? That must have been unprecedented.
Definitely. Yeah, during COVID-19, the role of infection control specialists was absolutely critical and incredibly intense.
What kinds of things were they doing?
They were central to developing the screening protocols for patients and staff coming into the hospital. They had to manage these incredibly complex and often fluctuating PPE inventories. Remember the shortages.
Right.
They were training staff constantly on guidelines that were changing sometimes daily based on new information from the CDC and WHO. And they conducted extensive contact tracing within the facility to try and limit spread. It was just this period of constant adaptation, immense pressure, and nonstop learning. It really highlighted how an invisible threat can impact literally every single aspect of healthcare.
Absolutely underscores the intensity. Let's take an even more extreme example, something thankfully rare but terrifying. What about dealing with the suspected Ebola patient? What kind of precautions kick in then?
Right, Ebola represents sort of the maximum level of precaution. The PPE requirements are incredibly stringent, far beyond standard hospital practice.
How's
It demands full body coverage. We're talking an impermeable gown, multiple layers of gloves, an N95 respirator, or more likely something called a PPR, a powered air purifying respirator.
great guy?
It's basically a helmet or hood with a battery-operated fan that filters the air and blows clean air towards the wearer, offers an even higher level of respiratory protection, plus a full face shield or goggles, and boot or shoe covers.
Wow, full armor.
Pretty much. And crucially, putting on this gear donning and especially taking it off doffing requires a trained observer watching every single step to prevent any accidental self-contamination. It's extremely high risk. It really highlights the intense rigor and the stakes involved in those worst-case scenarios.
It certainly does. Given how fast things change, new viruses, evolving bacteria, updated guidelines, how do these specialists stay current? It must feel like a never-ending learning curve.
It absolutely is a continuous learning process. The sheer volume of information can be immense.
So how do they manage?
They meticulously follow updates from key organizations, the CDC, the World Health Organization, local public health departments. They attend specialized workshops and conferences. They subscribe to relevant professional journals. And they actively participate in professional networks, listservs, associations to share knowledge, discuss emerging threats, and learn best practices from colleagues. It's really about a commitment to lifelong learning to stay prepared for the next unknown threat.
Makes sense. And finally, after all this work, the protocols, the training, the tracking, how do they actually know if their programs are working? How is effectiveness measured?
That's the million-dollar question, right? Measuring effectiveness is key, but the real challenge is understanding the story behind the numbers.
What do you mean?
Well, yes, we track infection rates like rates of surgical site infections or central line infections, but a drop in reported infections might look great, but what if it's just because people aren't reporting them properly? That's not actual improvement.
Right. Good point.
So that's why we also conduct regular compliance audits. Are staff actually washing their hands correctly? Are rooms being cleaned according to protocol? We gather feedback from staff on the processes because they often have invaluable insights into what's working and what's not on the ground.
Getting that frontline perspective.
Exactly. And critically, we compare our metrics against established benchmarks, national data, for example, or against our own historical data. This helps us see if we're making genuine improvements or identify areas that need immediate attention. It's really about building a holistic picture, not just looking at one isolated number.
This deep dive has really, truly highlighted the vital work these infection control specialists do, so often unseen, as we said. From the basics of hand hygiene every day to leading the charge during a global pandemic, their role is incredibly comprehensive and just absolutely critical.
They really are those unseen guardians, constantly
Yes.
adapting, constantly vigilant.
They are. And what's really fascinating, I think, is seeing how multifaceted infection control is. It's this dynamic blend of cutting-edge science, yes, but also meticulous training, clear communication, and just constant quiet vigilance.
Yeah.
It's an ongoing battle, really, against an invisible enemy fought by these incredibly dedicated professionals. And maybe this raises an important question for you, the listener, to think about.
Okay.
Now that you understand a bit more about these hidden layers of protection and the sheer dedication these specialists bring to their roles, how might your own awareness influence your daily practices, or maybe deepen your appreciation for the complex public health efforts that are happening all around us, often silently?